1. When designing a training module on venipuncture safety, which strategy best reflects adult learning principles to engage learners? A. Providing a long lecture with minimal interaction. B. Allowing learners to share past experiences in group discussions. C. Using only written manuals and handouts. D. Testing without any prior practice sessions. 2. A phlebotomy instructor wants to assess whether students can correctly follow the order of draw. Which evaluation method is most appropriate? A. Multiple choice written test. B. Practical demonstration under observation. C. Peer grading based on notes. D. Oral presentation without practice. 3. In curriculum development for a phlebotomy certification class, which element ensures alignment with regulatory compliance? A. Including topics based solely on instructor preference. B. Prioritizing only advanced procedures. C. Incorporating current CLSI and OSHA standards. D. Using outdated textbooks for consistency. 4. During mentoring, a senior phlebotomist notices a trainee labeling specimens incorrectly. What is the most effective mentoring response? A. Ignore the mistake to maintain confidence. B. Provide corrective feedback immediately and demonstrate proper labeling. C. Wait until the end of the day to address the issue. D. Criticize the trainee in front of patients. 5. A communication strategy that best prevents patient anxiety before blood collection is: A. Using complex medical terminology to show expertise. Avoiding conversation entirely to stay efficient. C. Explaining the procedure in simple, reassuring language. D. Only answering questions if the patient insists. 6. Which evaluation method best assesses higher-level critical thinking in phlebotomy trainees? A. Matching terms with definitions. B. Simulated scenarios requiring decision-making. C. Fill-in-the-blank worksheets. D. Memorization of tube colors. 7. When revising a phlebotomy curriculum, what factor should take precedence to maintain professional standards? A. Inclusion of outdated techniques for tradition. B. Alignment with updated CDC and OSHA guidelines. C. Reducing practice time to save resources. D. Emphasis only on written assessments. 8. In adult learning, which approach helps learners retain knowledge about infection control? A. Passive listening to a lecture. B. Memorizing infection control policies word for word. C. Participating in interactive case studies and role play. D. Watching a video without discussion. 9. A phlebotomy trainer wants to ensure regulatory compliance with HIPAA. Which instructional example is best? A. Encouraging trainees to discuss patient cases with friends. B. Demonstrating how to protect patient identifiers during documentation. C. Sharing patient lab results in group training without redaction. D. Posting patient details on a classroom board. 10. Which communication technique should a phlebotomist use to confirm patient identity? Asking, "Are you John?" and proceeding if the patient nods. B. Checking wristband and asking patient to state full name and date of birth. C. Relying solely on the physician's request form. D. Asking a family member for identification. 11. What is the most effective evaluation tool for assessing a trainee's ability to handle difficult patients? A. Multiple choice test on theory. B. Simulation role play with standardized patients. C. True-false quiz on patient behavior. D. Reviewing textbook notes. 12. A key mentoring technique to build confidence in new phlebotomists is: A. Assigning only complex procedures immediately. E. Providing constructive feedback and incremental challenges. C. Criticizing errors without explanation. D. Avoiding feedback to reduce stress. 13. Which aspect of curriculum development ensures that phlebotomy students are workplace ready? A. Focus on theoretical knowledge only. B. Integration of practical labs with safety protocols. C. Elimination of hands-on practice. D. Heavy emphasis on memorization. 14. In adult education for phlebotomy, why is self-directed learning important? A. Adults prefer strict instructor-led methods only. B. Adults are motivated by personal relevance and application. C. Adults learn best through passive note-taking. D. Adults require no connection to practical experience. 15. When evaluating competency in infection control, which method demonstrates the highest validity? A. Written exam on universal precautions. E. Observation of hand hygiene and PPE usage during practice. C. Group discussion on contamination risks. D. Peer feedback on infection control scenarios. 16. A phlebotomy mentor can best support knowledge retention by A. Repeating technical information without context. B. Providing opportunities for practice and reflection. Giving all instructions at once without follow-up. E. Reducing practice sessions to save time. 17. Which regulatory requirement must be addressed in every phlebotomy training curriculum? A. Patient confidentiality and HIPAA compliance. B. Marketing strategies for lab services. C. General anatomy without relevance to venipuncture. D. Physician diagnostic techniques. 18. A phlebotomist is explaining venipuncture to an anxious patient. Which adult learning principle applies? A. Respecting the patient's need for clear, concise information. B. Avoiding questions to maintain authority. C. Using jargon to emphasize professionalism. D. Giving vague responses to reduce detail. 19. What is the best method to evaluate mentoring effectiveness in a phlebotomy setting? A. Measuring mentees' improvement in lab accuracy and efficiency. B. Counting the number of mentoring sessions held. C. Asking only mentors for feedback. D. Ignoring results and focusing on participation. 20. In developing a phlebotomy assessment plan, which ensures fairness and accuracy. A. Using multiple methods such as written, oral, and practical tests. B. Relying on one written exam only. C. Eliminating performance-based testing. D. Allowing students to choose their own grading criteria. 21. Which communication strategy aligns with ethical and regulatory compliance during specimen collection? A. Discussing patient conditions openly with other patients. B. Keeping instructions clear, private, and confidential. C. Using humor that reveals patient details. D. Recording the procedure for public teaching without consent. 22. A phlebotomy instructor wants to mentor students struggling with venipuncture confidence. Which method is best? A. Encouraging gradual exposure with guided support. B. Forcing them into immediate, unsupervised practice. C. Avoiding practice until they feel ready. D. Withholding feedback until after certification. 23. What ensures that a phlebotomy curriculum stays compliant with current standards? A. Annual review and integration of updated regulatory guidelines. B. Keeping the same content year after year. C. Allowing students to design the curriculum. D. Ignoring changes to reduce workload. 24. Which evaluation method best distinguishes between students who understand phlebotomy ethics and those who do not? A. Scenario-based questions requiring judgment. B. Memorization drills on terminology. C. True-false statements on ethics. D. Fill-in-the-blank forms. 25. A trainee repeatedly uses the wrong needle gauge. As a mentor, the best approach is A. Criticize harshly to correct behavior quickly. E. Demonstrate correct use and supervise repeated practice. C. Avoid addressing the mistake until later exams. D. Assign extra unrelated reading. 26. In adult learning, the role of immediate feedback in phlebotomy training is to A. Discourage questions. B. Reinforce correct techniques and correct errors quickly. C. Replace the need for practice. D. Reduce learner accountability. 27. Which curriculum feature best supports adult learners preparing for a phlebotomy test? A. Clear objectives tied to workplace tasks. B. Ambiguous instructions with minimal context. C. Excessive theoretical content without practice. D. Repetitive memorization drills. 28. A phlebotomist must collect blood while respecting patient rights. Which regulatory compliance issue is most relevant? A. Obtaining informed consent before collection. B. Using shortcuts for faster results. C. Ignoring patient refusal. D. Sharing patient results publicly. 29. The best evaluation method to ensure phlebotomy trainees understand emergency protocols is A. Written exam only. B. Mock drills simulating real emergencies. C. Peer discussion without action. D. Reading protocols silently. Artie. During mentoring, how should feedback be delivered to maximize professional growth? A. Focus only on errors without mentioning strengths. E. Provide balanced, constructive, and specific guidance. C. Deliver vague comments with little context. D. Delay all feedback until final evaluation.